Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 266. Coarctation of the aorta. What can happen due to coarctation of the aorta? Coarctation of the aorta can result in aortic regurgitation. What is the infantile type of coarctation of the aorta? The infantile type is where the aortic stenosis happens proximal to the insertion of the ductus arteriosus. So this happens preductally, and this is known as the infant type. What condition is associated with the infantile type of coarctation of the aorta? Infantile type of coarctation of the aorta is associated with Turner syndrome. What is the mnemonics to help you remember infantile type coarctation of the aorta? The mnemonics to help you remember is infantile, which has the word in it, which means that it's in close to the heart. So it's closer to the heart, and this is the infantile type. What should you do in a physical exam to detect infantile type of coarctation of the aorta? In infantile type of coarctation of the aorta, you would want to check the femoral pulse. What is adult type coarctation of the aorta? Adult type coarctation of the aorta is when the stenosis is distal to the ligamentum arteriosum, which means it's postductally. What are some of the conditions that would result from adult type coarctation of the aorta? In adult type coarctation of the aorta, it would lead to notching of the ribs, and this happens due to the collateral circulation. It would also lead to hypertension in the upper extremities and weak pulses in the lower extremities compared to the upper. What is the mnemonics to help you remember adult type coarctation of the aorta? The mnemonics to help you remember this is that the word adult has a D in it, and in adult type coarctation of the aorta, coarctation is located distal to the ductus. Adult type coarctation of the aorta is most commonly associated with what type of valve condition? Adult type coarctation of the aorta is most commonly associated with a bicuspid aortic valve.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.